Selamat siang semuanya, saya Ira dari Lavender Medicare. Hari ini saya bersama Dr Pang Yoke Teen di Mount Elizabeth Orchard. Dr Pang, have you ever had patient who come to you and say, "Oh, I have runny nose, itchy nose, and I sneeze every morning"?
Almost 70% of my patient comes in with this kind of symptoms. So what you are describing are actually symptoms of allergies. So most patients will call this sinus, meaning is that they have regular blocked nose, sneezing, runny nose, itchy eyes, itchy nose. So these are all symptoms of allergy of the nose. Allergy is an abnormal reaction to things that we normally do not react to. Allergy can affect you in different ways. It can affect your eyes, in which case we call it allergic conjunctivitis. If it affects your nose, we call it allergic rhinitis. If it affects your lungs, we call it allergic asthma. So you'd be surprised, a lot of asthma is actually caused by allergy. So if you take care of the allergy, the asthma also disappears. So it can also affect your skin, and some form of eczema can be allergic related. In some individuals, they have problems with their gut as well, so they can have symptoms of diarrhea, bloating, and all this can be part and parcel of allergic reaction.
So the solution is to remove the allergen, then you are free of the illness.
Yes, that's the straightforward way. Don't get exposed to the allergen, you will not have the symptoms. In my practice, we have a lot of patients coming in with sneezing, runny nose, and say, "Hey, doctor, I have this sinus. I have this sinus since I was young. Nobody can cure it." I was told that there's no cure for sinuses. That is not actually true. So, in these individuals, I work with them and find out what their normal lifestyle routine is, where they get exposed to symptoms and which is worse. And once we roughly know what's the situation, we do some tests for them.
I know that there is blood test that we can use to test allergies. Is it more accurate than the prick test?
So in my practice, typically I would prefer to do the skin prick test first, the skin test first, because it's done in the clinic and the result is immediate. Blood test, you have to send it off to a lab, and that takes a couple of days.
So can you actually cure allergy?
Yes. So commonest allergy in this part of the world is allergy to dust or house dust mites, to be specific. So if an individual is allergic to house dust mites, usually what we advise them is look at your environment, reduce the exposure, clean up your environment, clean up your bed, remove all the stuffed toys, remove all the carpets, and see how you go. If that doesn't completely solve the problem, there are medications like nose sprays and antihistamines. All this is helpful in controlling the symptoms. It controls the symptoms, but it does not cure you of the problem. So there is a different form of management called immunotherapy, where the management is actually targeted at your immune system. So it basically makes your body stronger, not react to the allergens in the same way. So dust mites, for example, if you are allergic to dust mites, after we treat you with immunotherapy, you will no longer react to dust mites, in a way cured.
Is there any side effect of the immunotherapy?
Immunotherapy for allergy is actually very safe. In fact, immunotherapy, in my view, is like an oral vaccine. It's a vaccine that we give our patients so that we can immunize them against what they are allergic to. Immunotherapy for allergy does not suppress the body immune system at all. Say if you are treating dust mite allergy, the immunotherapy is specific for dust mite allergy. So it does not make your body less responsive to other treatment. It doesn't make you immunologically deficient. That means you are like a normal individual, just that you no longer react to the things that used to cause you problems.
How long does the immunotherapy last?
Usually the results suggest that the patients will be protected up to a period of 10 years.
Thank you so much, Dr. Pang, for your time. I'm sure it's very useful for our audience to know that there's another alternative to treat the allergy. Thank you.
Thank you, Ira.